So we have a patient who presents with high activity of LDH1 and 2. LDH1 and 2. LDH1 and 2. We have aspartate aminotransferase, creatinine phosphokinase. Guys, do you remember this creatine phosphokinase? We said it has to do with what? Muscle breakdown. If you can remember yesterday, where we talked about Duchenne dystrophy, Duchenne muscle dystrophy. We spoke about this yesterday, if you can remember. That's the enzyme that is normally what released when muscle fibers are being what broken down. So the question is, in what organs is the development of this pathological process the most probable? So we are thinking of an organ where when it's breaking down, we have low density, we have LDH, we have LDH 1 and 2, we have LDH 1 and 2. Then we can also think of what? Aspartate. We can also be thinking of what? Aspartate. So first of all, like I said, creatinine is seen in what? Muscle what? Breakdown. And it is normally found in the heart, the brain, and the skeletal muscles. If I were you, I will write this down. So either in the heart, in the brain, and in the skeletal muscles, you will find creatinine or creatine phosphokinase. Creatine phosphokinase. Now, when we go to LDH1, it is predominantly found in the heart and in the RBC. LDH1 is found in the heart and the red blood cells, or RBC. And of course, it can also be found in the brain. Now, ALT and AST, of course, we already know that it's a liver enzyme, but it can also be found in the heart as well, especially when the AST is higher than the ALT. When the AST is higher than the ALT. So therefore, we can boldly, from what I've just said, we can boldly say that this dystrophy is taking place in the heart. It is taking place in the heart. So in myocardial infarction, we have LDH1 and 2 being released. We have aspartate being released. We have creatinine phosphokinase being released. So therefore, our answer will be what? The heart muscle, or the initial stage of myocardial infarction. So C will be our answer. C will be our answer. Now, if it were to be just creatinine phosphokinase, like I said, predominantly you will find it in what? In skeletal muscles. But then you can't find LDH1 and 2 in skeletal muscles. Technically, you can't find them. So that's over here. We are going in for C as our likely pathological process. We have a buffer capacity of blood was decreased in the worker due to exhausting muscular work. Definitely, what they're trying to tell us is that, or ask us is, when a person is working, okay, what happens to the muscles? What happens to the muscles? One way or the other, we have all experienced this before, that even while you are gymming, or when you are running, or when you are doing something vigorous, you realize that there are muscle pains. These muscle pains are as a result of anaerobic respiration. Anaerobic respiration. That means in the absence of what? Oxygen. So therefore, what happens is that instead of glycolysis giving you the energy, lactic acid will be giving you that sort of what? Energy. So that will be the pathway it will be going. It will go through the pathway for what? Lactate or lactic acid. Lactic acid. So here we are thinking of what? Lactate. Lactate. Because there's what? Muscle tiredness or weakness. Okay. All right. Or muscle pains. We have, while examining a child, the doctor revealed symmetric cheeks roughness. When we say symmetric cheeks roughness, we are referring to what? Dermatitis. Dermatitis, that's inflammation of the skin or rashes on the skin or a problem with the skin. So dermatitis. So symmetric chest roughness. Then we have what? Diarrhea. Then we have dysfunction of the nervous system. So lack of what food component caused this? Now, the disease in this question is called Pellagra. Pellagra. I don't know if you have heard about it, but Pellagra is simply a vitamin B3 deficiency. Vitamin B3 deficiency. And it is characterized by 3Ds. If I were you, I'll write this down. 3Ds. That is dermatitis, dementia, and diarrhea. Dermatitis, dementia, and then diarrhea. These three things are very, very classic for vitamin B3 deficiency. Vitamin B3 deficiency. And another name for vitamin B3 is niacin. 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 And sometimes we even call it what? PP for Pellagra. PP. 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 And of course, it is normally produced or it is derived from tryptophan. It is derived from the amino acid called tryptophan. 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 So over here, we are thinking of what? Nicotinic acid. Also the same as the niacin or the same as vitamin B3. Is the same thing. And it is derived from tryptophan. So here, we are thinking of what? B as our likely cause or deficiency. Deficiency. Don't forget the 3Ds. Diarrhea, dermatitis, and dementia. Dementia. That is problem with what? Forgetfulness or something like that. All right. So the answer is B. A 13-year-old boy complains of general weakness. There is dizziness and tiredness. He is mentally retarded. There's an increased level of, look at this. These are amino acid, valine, isoleucine, leucine in the blood and urine and has a specific smell. What is the diagnosis? What is the diagnosis? First of all, you need to know the enzyme that helps in the metabolism of these amino acid. That's the valine, the isoleucine, and then the leucine. And the name of that enzyme is called branched chain alpha keto acid dehydrogenase. I repeat, the name of the enzyme is called branched chain alpha keto acid dehydrogenase complex. Dehydrogenase complex. So when this enzyme is deficient, it leads to what? The increase in leucine, isoleucine, valine. And of course, if they are too much in the system, what happens is that you begin to find them in the blood and in the what? In the urine. Now, this phenomenon whereby there's a deficiency of this branched chain alpha keto acid dehydrogenase complex is called maple syrup urine disease. Maple syrup urine disease. That is the name of the disease or the phenomenon whereby there is a deficiency of this enzyme called branched chain alpha keto acid dehydrogenase complex. All right. So here we are talking about what? Maple syrup urine disease. All right. We have an increased breaking of vessels, enamel, and dentine disruption in scurvy. You know what the scurvy is. Scurvy is what? A deficiency of what? Vitamin C. Vitamin C. And yesterday we made mention that vitamin C is involved in what? Collagen metabolism or collagen formation. And collagen forms part of the connective what? Tissue. It forms part of the connective tissue. That is why when there's a deficiency of collagen formation, there will be bruises. There will be rashes. There will be anemia because the vessels will be breaking down. Okay, that is what happens. Scurvy, because it's involved in collagen what? Formation. It is involved in collagen formation. And they use a process called what? Hydroxylation of proline and lysine, even glycine. So three things come to play when it comes to what? Vitamin C or scurvy or collagen formation. They help in hydroxylation of proline. They help in hydroxylation of lysine, and they even helps in hydroxylation of glycine. So you can write it down: proline, glycine, and then lysine. Proline, glycine, and then lysine. So what it means is that when there's a deficiency of this vitamin, there will be an increased level of what? Proline, lysine, and glycine. And you can see them in the blood and also what? In the urine. Also in the urine. So the question now is that what stage, of course, they've told us that there's a disorder of what? Collagen maturation or maturing. What stage of modification of procollagen is disordered? Again, we said what is involved in what? Hydroxylation of what? Proline, lysine, and glycine. So over here, what should be your best option? Of course, hydroxylation of what? Proline. So therefore, your answer is E. All right. We have a 62-year-old female patient that has developed what? Cataract. Cataract. Now, a cataract is simply the clouding of the lens in the eye, which leads to a decrease in vision. So when there's cloudiness in the eye, it leads to what? Decrease in vision. It leads to decrease in vision. And they are saying that this occurs as a result of what? Diabetes mellitus. And we know in diabetes, glucose is high. Glucose is high. And this glucose have high affinity for what? For proteins. They also have high affinity for what? For proteins. So when too much glucose is in the blood and they get interacted with the glucose, what happens? So with the proteins, what happens is that they now enter the eye and they begin to cause that what? Cloudiness. They cause that cloudiness. In the process of binding glucose to protein is called what? Glycosylation. Glycosylation, where it binds to the amino groups of the what? The proteins of the proteins. And these products can accumulate in the vessel walls, example, in the eye. So here we are thinking of what? Of A. So actually, this is one of the complications of diabetes mellitus or mellitus. So your correct answer is A. We have aspirin. The last time we spoke about aspirin, we said it's what? A non-steroidal anti-inflammatory what? Drugs. What does it do? It blocks COX-1 and COX-2. COX-1 and COX-2. And what do we say about it? We said this COX-1 and COX-2 helps in the production of what? Prostaglandins. And these prostaglandins are actually needed in the what? In the stomach. They are needed in the stomach and many other what? Tissues, but mostly in the stomach because it serves as a protective what? Covering, or it serves as a shield for the stomach or the mucosa what? Lining. That is why when people are suffering from pains and stuff like that, you have to be very careful of the medication that what you give to the patient. If you give it for a long term, it can lead to what? Ulcer formation. So like I said, they are saying it inhibits what? Cyclooxygenase. That is the same as what? The COX-1 and the what? The COX-2. So what biological active acids will decrease? Of course, we are saying it will decrease what? Prostaglandins what? Formation. So your likely answer is what? Prostaglandins. A. In medicine, you apply. So always apply. All right. We have pain along nervous stems and increased amount of pyruvate. Guys, do you remember pyruvate? Of course. And we made mention about what? The coenzyme or the cofactor for pyruvate. What did we mention? We mentioned what? Thymine. We mentioned thymine. And thymine comes from what? Vitamin B1. Thymine comes from what? Vitamin B1. So look at the question. They say it was increased in the blood. Insufficiency of what vitamin? Of course, vitamin B1. Vitamin B1. Okay. We've already done this. That's why I'm just going fast on it because I'm sure you guys understand it already. However, if you have any question, feel free to ask and then I'll go over it for us. All right. At the laboratory experiment, the leukocyte culture was mixed with Staphylococcus cocci. Neutrophilic or neutrophil leukocyte engulfed, guys, this is your guy, engulfed and digested the bacterial wall. You see the process whereby usually macrophages, right, engulf a substance or engulf a bacteria is called what? Phagocytosis. It is called phagocytosis. 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 So that's what you are what? Thinking about. So neutrophils, macrophages, monocytes, dendritic cells, and so on and so forth, all undergo what? Phagocytosis. They undergo phagocytosis. That's why when a bacteria or when someone is infected with some bacteria, these neutrophils will appear at the place to engulf around them. And the process is called what? Phagocytosis. Phagocytosis. So here we are thinking of D as our likely answer. Examination of a patient revealed typical presentation of what? Collagenosis. Again, what is collagenosis? That means a disease of collagen or a disorder in collagen what? Maturation or what? Formation. And again, what comes to mind? You are thinking of what? Vitamin what? C. You might be thinking of what? Vitamin C. And with vitamin C, what do you think about? You are thinking of what? Hydroxylation of proline, hydroxylation of glycine, or hydroxylation of what? Of lysine. Of lysine. We've made mention about this today. So please don't forget. So over here, what are we looking for? We are looking for what? Hydroxylation of proline. And that your answer is what? Hydroxyproline is the same thing as hydroxylation of proline. Hydroxylation of proline. So I believe when you see a question on collagenosis or scurvy or vitamin C deficiency, please don't get yourself confused. You know what to do. All right. Marked increase activity of MB form of CPK. Do you remember CPK? Of course, creatinine phosphokinase. And I said they occur in what? In muscle destruction or in muscle dystrophy or degeneration of what? Of muscles. Now look at this. They said there's what? LDH1. I think this shouldn't confuse you because we have already done LDH1. And we say LDH1 is very, very specific for the what? For the heart. It's specific for the heart. Am I right? Of course. So we have CPK and then LDH1, which is specific for the what? For the heart. So here we are thinking of what? Of myocardial infarction. Myocardial infarction. Myocardial infarction. You see, it's the same question, but formulated in a different way. So if you don't understand it, you will say it's a new question, but it is not. That is why it is key to understand every single question in Krok, because the same thing will be repeated, but might be in a different form or fashion. And you should be able to catch it because you understand the question. Now we have untrained people often have muscle pain after sprint, of course. Just like Paul will be running or doing exercise. After some time, he will be having what? Pain in the muscles. Pain in the muscles. As a result, we've already discussed this. As a result of what? Lactate accumulation. Why? Because the person is producing energy through a process called what? Anaerobic respiration. Not aerobic. It is what? Anaerobic. That means in the absence of what? Oxygen. in the absence of oxygen. In the absence of oxygen. So over here, this might be caused by intensification of the following biochemical processes, and of course, the process of producing energy for the muscles or for your body is called what? Glycolysis. 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 All right. So that's the process whereby it goes through. But when it gets to the PPP portion, or where we have the CAC portion, where the proper energy is now produced, that is where we have the differences. That is where we now have what? The differences, whereby this will enter into what? Lactate, and this will enter into what? Into energy, or the pentose phosphate pathway. The pentose phosphate pathway. So here we are thinking of what? Glycolysis. 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 Because, yeah, basically that's just it. Glycolysis. We have a 16-year-old boy was performed an appendectomy. That's the removal of the what? The appendix. He has been hospitalized for lower quadrant abdominal pain for 18 hours. Now, the surgical specimen is edematous and erythematous. Infiltration by what of the following cells is the most typical for the process occurring here? What it means is that when there's a site of inflammation, which one of these cells are the most dominant or are most typical to be occurring? Of course, you are thinking of what? Neutrophils. You are thinking of neutrophils. You are thinking of neutrophils. So here, that is what we are thinking about, neutrophils. So they come there in abundance just to what? Engulf around the bacteria that is present. So here, you are thinking of neutrophils. So A is your answer. Now, ATP synthesis is totally blocked in a cell. Now, when we say ATP, we are referring to what? Energy. So energy synthesis is totally blocked in a cell. So imagine you as Lucy, okay? Your energy is totally shut down. What can you really do? Of course, you can do nothing. You can't walk, you can't do anything. So now the question is, how will the value of the membrane rest potential change? Of course, it will disappear because there's no energy. Because membrane potential deals with what? Energy. Or it deals with the movement of what? Ions. And the movement of ions comes with what? ATP. Or it comes with what? Energy. It comes with what? Energy. Or the use of what? Energy. The use of energy. For potassium to cross the cell membrane and for sodium to cross, they all depends on what? On energy usage, or they depend on ATP. 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 So here, your answer will be what? Will be A. Will be A. All right. We have the concentration of albumins in the, albumins, they are example of what? Proteins. In the human blood sample is lower than normal. Yesterday, we talked something about edema formation, and we said edema is controlled by what? Two basic factors. That is the oncotic pressure and the hydrostatic pressure. Hydrostatic pressure deals with volume of what? Water or the fluid, whilst oncotic pressure deals with the presence of what? Solute. And we said for the blood, we are dealing with what? With proteins. And the high amount of proteins usually, or the part of the protein that we are talking about are the albumins. The albumins. So the albumins is used to maintain what? Oncotic pressure. Oncotic pressure. Oncotic pressure. Oncotic what? Pressure. So the question now is that they say the concentration of albumins in the blood is lower than normal. So if it is lower, it means there will be what? Edema what? Formation. Because fluid will now move from the vessels into the what? The tissues. And they are saying that this leads to what? Edema, of course. So what blood function is damaged? Of course, the oncotic pressure is damaged. The oncotic pressure is what? Damaged. We talked about this the last time. The oncotic pressure is what? Damaged. So maintaining it is damaged. So your answer is B. Now, examination of a patient suffering from frequent hemorrhages. Guys, you remember hemorrhages, right? Now, look at this. Of internal organs or inner organs and mucous revealed. Guys, look at it. We have proline, we have lysine. What comes to mind? Of course, vitamin what? C or ascorbic acid comes to mind. Ascorbic acid, you see, and they are included in what? In collagen fibers. Now, impairment of their hydroxylation is as a result of what? Of course, vitamin C. Vitamin C. Vitamin C. So don't get confused when you see this question. That is why you cannot fail Krok. If you understand it, it should be easy to pass Krok. It should be easy to pass Krok. You see, they've repeated this question like 3 or 4 times, even today. All right, so let's continue. A 20-year-old female patient complains of general weakness, dizziness, quick fatigability. That means gets tired what? Easily. Gets tired easily. So now, blood analysis shows what? Hemoglobin of 80. Now, normal hemoglobin level is 120. Now, over here, it is 80, which means that it is what? Low. No wonder the patient is what? Is tired and is weak and is feeling what? Dizzy. Now, microscopic examination results shows what? Erythrocytes are of modified form. This is your clue to your diagnosis. When I tell you that erythrocytes are of modified form, it means that these erythrocytes or red blood cells are sickled shaped. They are sickled shaped. Sickled shaped. So what condition is here? Sickle cell anemia. Sickle cell anemia. Sickle cell anemia. So here, quickly, your answer is what? Sickle cell A. All right. We have a 48-year-old patient complaining about what? Intense pain, slight swelling and reddening of the skin over the joint. Temperature is 38. Blood analysis reveal, guys, look at this. Uric acid or urate is the same as what? Uric acid. Yesterday, I remember I mentioned something about uric acid, and I said high concentration of uric acid or urate is called what? It's called gout. It is called gout. It is called gout. As a result, there will be pain in the what? In the joint. And this is produced from the breakdown of purines. It is produced from the breakdown of what? Of purines. And that is why over here, so the connection will be that there is a disturbed metabolism of what? Of purines. Purines. So here, your answer is what? Is D. Is D. Is D. Okay. Now, we have a patient that has yellow skin color, dark urine, and dark yellow feces. Dark yellow feces. So this is your clue. Of course, we know it's definitely what? Jaundice. So now the question now is it conjugated or unconjugated? If I were you, I'll write this down. In conjugated, the feces will be colorless. If I were you, I will write it down. In conjugated, the feces will be what? Colorless. But in unconjugated, the feces will be what? Dark yellow. Dark yellow. Dark yellow. So please write it down because you're going to meet similar questions somewhere. Because Krok, they repeat the questions, but in a different way. So please, your answer here should be what? Should be unconjugated bilirubin. Unconjugated bilirubin. Okay. A patient has increased, guys, look at it again. Pyruvate concentration. So pyruvate, what comes to mind? Of course, vitamin B1. Vitamin B1. Vitamin B1. Why? Because vitamin B1 is what? Thymine. And thymine is a cofactor or a coenzyme for what? For pyruvate. For pyruvate enzyme. So here, you are thinking of what? Vitamin B1. So D should be your answer. D should be your answer. Medicine is sweet, ladies and gentlemen. It's sweet. I love it. Now look at this. We're having ammonia. It's a very toxic substance, especially for the nervous system. I don't know if I said it here, but I think for Krok 2 people, we established this fact that ammonia is very, very toxic to the brain. Is very, very what? Toxic to the brain. So the question now is that what substance takes parts or takes the most active part in ammonia detoxification? In ammonia detoxification. So usually ammonia intoxication will occur when there's what? Too much of what? The ammonia in the blood. And you can only detoxify it by glutamate or by the use of what? Glutamic acid. Glutamic acid. Glutamic acid. Glutamic acid. So we use glutamic acid to detoxify this ammonia. This ammonia. So here we are thinking of what? Glutamic acid. Glutamic acid. It has affinity for the ammonia. It has affinity. So it will be capturing it. It will be capturing it and then to excrete it. To be capturing it and then it will excrete it. Because when they are too high, it will not be too good. There will be brain edema and all that. So here your answer is what? Glutamic acid. All right. Now look at this. The patient has Pellagra. Do you remember Pellagra we just spoke about? Of course. Vitamin what? PP deficiency or niacin. Vitamin B3. We made mention about this. We talked about this. And we said niacin or nicotinic acid comes from where? Of course, tryptophan. It comes from tryptophan or it is derived from what? Tryptophan. So all that they're telling us is that this disease has been caused by the deficit of the following substance in the maize. That is what? Tryptophan. Because in the maize, because the person has been eating maize for a very, very, very long time. So that could be that this patient is lacking what? Tryptophan. Because if tryptophan is present, it means niacin will be produced or vitamin B3 would have been produced. And Pellagra, again, what are the 3Ds? We have what? Dermatitis, dementia, and then diarrhea. And then diarrhea. That means this could be the symptoms of this particular what? Patient. Okay, so let's continue. So here, your answer is E. All right. We have an increased production of thyroidal hormones or thyroid hormone. That's a T3 and then T4. Weight loss, tachycardia, psychic excitement, and so on present on thyrotoxicosis. Of course, thyrotoxicosis simply means what? Increase what? Thyroid hormones. So how do thyroidal hormones affect energy metabolism in the mitochondrial cells? In the mitochondrial cells. Well, what I know is that there's always what? What I know is that there is always oxidative what? Phosphorylation. There is oxidative for what? Phosphorylation. That is what the thyroid or the T3 does on food substances. Then I go through a process called what? Oxidative phosphorylation. And out of it, they get the energy out of it. They get the ATP out of it. They get the energy out of it. So for me, the answer should have been what? Activated what? Oxidative phosphorylation. Activated oxidative phosphorylation. However, Krok says it is what? Disconnect oxidation and oxidated phosphorylation. I don't even understand what that even means. But there's a disconnection between what? Oxidation and then oxidative phosphorylation. But the question is asking us, what is the mechanism of what? Action. And that should have been what? Activated oxidative what? Phosphorylation. Or they work by activating the oxidative phosphorylation. All right. So please put this one at the back of your mind. This one you must know when it comes. Don't even think. Just know it that this is what? Disconnect oxidation and oxidated phosphorylation. But like I said, what I know about mechanism is that It involves what? Oxidative phosphorylation. Okay, so I would have gone for E instead of B, but Krok says the answer is B. So please, we stick with it. Okay, now a patient has high rate of obesity and was advised to use carnitine as a food additive in order to enhance fat burning. What is the role of carnitine in the process of fat oxidation? So first of all, you must understand that carnitine plays a critical role in energy production. And how does it do? It transports long-chain fatty acid from the cytosol, that's the cell, into the mitochondria, so that these substances or fatty acids can be oxidized or can be burned to produce the energy. I repeat, so it transports what? Fatty acid from the cytosol into the what? The mitochondria, so that they can be oxidized or burned to produce the energy. So what this person was encouraged to do is that they want to burn the what? The fat. They want to burn the fat. So here, you're definitely going what? For A. That is the mechanism of what? Action. Free fatty acid from the cytosol to the mitochondria. Please take note of it, because I've seen this question severally. So please, your answer is what? Transport of free fatty acid from the cell to the mitochondria. So here, your answer is A. All right. We have an experimental animal that was kept on a protein-free diet, developed fatty liver infiltration. Guys, do you remember fatty liver infiltration? Of course, we are talking about what? Hepatic steatosis. And what do we talk about hepatic steatosis? We said it occurs when there's a deficiency of what? Of choline. And when there's deficiency of choline, what it means is that there'll be a deficiency of what? Of methionine. You remember this? There'll be a deficiency of what? Of methionine. And when there's a deficiency of methionine, it means methylation will not what? Will not take place. Methylation would not take place. We said this one the last time, yesterday, if I'm correct. We said it. So over here, what are you thinking about? They've already told you there's what? Choline. So here you're going for what? For your choline. In the other question, I think the answer was methionine. And why? That was because if there is decrease in methionine, definitely it means there's a decrease in what? In choline. So here your answer should be what? Should be A or SA. All right. We have a patient consulted a doctor about, guys, do you remember this symmetric dermatitis? In the other question, they said symmetric chick something. But over here, they told us this was symmetric dermatitis. And I've told you, when you see dermatitis, diarrhea, and dementia, what comes to mind? Of course, you are thinking of what? Pellagra, or niacin deficiency. And if it is niacin deficiency, what acid comes to mind? Another name for niacin is what? It's nicotinic what? Acid. It's nicotinic what? Acid, which is the same as what? Nicotinamide. Is the same as what? Nicotinamide. It's a form of what? Vitamin B3. So please, don't worry yourself plenty when it comes to these easy questions. Symmetric dermatitis. So here, your answer is B. All right. I love this. Now, a 46-year-old woman suffering from cholelithiasis developed jaundice. Guys, look at the physics. They said her urine became dark yellow. Feces became colorless. Guys, colorless. What comes to mind when we have a colorless feces? Remember, colorless, not dark yellow. This is what? Colorless. So what comes to mind? Of course, conjugated. In unconjugated, the feces what? Will become what? Dark yellow. We spoke about this. And I believe you have written it down. So it's easy to remember this. All right. We have a 46-year-old patient applied to a doctor complaining about joint pains that became stronger the day before weather changes. Look at this again. Blood examination revealed concentration of uric acid. Again, when there's a concentration of uric acid, what does it mean? It means there is what? Gout. So the diagnosis here is what? Is gout. Gout. So what comes to mind? You are thinking of what? Purines. Purines. You are thinking of purines. You are thinking of what? Of purines. And that's why over here, the example of purine is what? Adenosine monophosphate. Adenosine monophosphate. This is the same as what? Purine, or this comes from purine. It comes from purine. So please, you are thinking of this as what? As adenosine monophosphate, which is the same as purine. So if they didn't bring purine in the bank, adenosine monophosphate, it is the same thing. It is the same thing. So if I were you, I will write this down because it is a high yield question. Purine or adenosine monophosphate. Adenosine monophosphate. And don't forget, there's another pathway whereby uric acid are produced, where we have the xanthine and then the hypoxanthine. Good. That was just by the way. I just want to make sure that I'm not confusing you on this uric acid stuff. Okay, so here your answer is A. We have a 42-year-old man suffering from gout. Guys, look at this. Gout. What does it mean? It means there is high concentration of what? Uric acid. High concentration of uric acid. Has increased level of urinary acid in the blood. Guys, look at it. They said they give what? Allopurin was prescribed to decrease the level of what? The acid. So what is the function of allopurinol? Allopurinol. Allopurinol is a competitive inhibitor. Do you remember when I mentioned about the xanthine and the hypoxanthine? We said that that is the last pathway whereby uric acid is being what? Produced. So when that pathway is blocked, what happens? It means the uric acid will not be what? Be produced. It means the uric acid will not be what? Be produced. And again, we say what? Uric acid comes from what? From purine. It comes from what? From purine. However, in the metabolism, whereby the final product will now be the uric acid, it is mediated by what? An enzyme. And that enzyme is called what? Xanthine oxidase. We did it yesterday. Xanthine oxidase. Xanthine oxidase. So here, you are thinking of what? D. Again, don't confuse xanthine oxidase with purine. Like I said again, gout means uric acid is high, okay? And this is obtained or comes from purine. So a breakdown of purine leads to an increase in what? Adenosine monophosphate. And this adenosine monophosphate now have to be broken down to form what? The uric acid. And we are seeing that the final pathway for the uric acid production is the what? The xanthine and the hypoxanthine, where it will now be converted to what? To uric acid. Now, that place or around that area, there's an enzyme that mediates it. That enzyme is called xanthine oxidase. Xanthine oxidase. So we realize that people are, how do you call it? When we realize that somebody is having gout, what do we give? We have to give the person what? A competitive what? Inhibitor. So that enzyme must be what? Inhibited. If that enzyme is inhibited, that means that uric acid will not be produced. It will not be produced. And as a result, we have achieved our aim. So here, your answer is what? D. All right. We have a 38-year-old patient who suffers or is suffering from what? Rheumatism in its active phase. Now, in a cell or in the blood, if any inflammation is in the active phase, what it means is that there will be an increase in CRP proteins or C-reactive proteins. C-reactive proteins. It is a sign that an infection is going on acutely. An infection is going on what? Acutely. 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 So here, your keyword is what? Rheumatism in its active phase. That's why over here, your answer should be what? C-reactive protein. C-reactive protein.